Dr. Rebecca Brashears from Ascent Audiology and Hearing is here today to share what to do if you start noticing problems with your ears. And I see that you brought the big ear today.
I did.
So what would be some things that, let's talk about the differences between what you do and other professionals in the community do.
Yeah, so there's many occupations that have divided up into different specialties.
Okay.
So say when in regards to the ear, you have to kind of look up and find out who you should see. That way you're getting the appropriate care and the appropriate treatment. So for instance, there's audiologists. There's also ENTs. They're called otolaryngologists. And both of us have different levels of education and different areas of specialty. So it's really important to investigate prior to making an appointment.
Yeah, well, how do we know which one we need? Talk a little bit about what you do.
Yeah, so as an audiologist, so I'm a expert in all aspects of hearing healthcare, basically. And audiologists typically prevent, identify, diagnose, and treat hearing loss. We also deal with tinnitus, so sounds in the ears when no sound is really present. We remove wax, so all of that is included in our scope of practice. Now, of course, we also do the rehabilitation, so we're the experts in the technology, the hearing aid technology, and what other extras can we do to help people in that rehabilitation process.
Okay, so what about an ENT? How do we know if we need to see that specialist?
Yes, so an ear, nose, and throat doctor literally specializes in the ear, nose, and throat, and it's more the medical side. So they're going to, treat infections, if you have drainage, ear pain, if you have abnormal growths, they'll do surgeries on the ears. Now, the ENT does not test hearing, so if they have someone that has a potential hearing loss, they'll send them to an audiologist for testing. And then if there's something medical to be treated, he'll go back and treat that as well. So we kind of go hand in hand in what we do. Yeah.
I didn't realize that that often happens.
Exactly. So, if you have something medical going on, then we definitely want you to see an ENT. But, a lot of times people just have a hearing loss that's related to aging, noise exposure, and they don't need that extra appointment. So it just depends on what's going on.
Okay, so who would the primary healthcare person be, the professional, to treat hearing loss, if that's what you think that you have?
Exactly. Hearing loss alone, then you need to make an appointment with an audiologist. So you might start to find that you're turning that television up a little bit louder, people are mumbling, or you're constantly asking for repetitions. And so then it's time to probably make that appointment with the audiologist. And, we'll of course do the hearing test. And if we do see something medical, we're going to always refer you out. We have guidelines we kind of go by. But most of the time when we see patients for hearing loss, it's that pure hearing loss.
Right, and I think a lot of people probably put things off like that because they're like, I don't want to know what they find out. But what would you typically do when they come in?
Yep, so first we would talk a little bit and get that history. So any kind of ear history, so make sure you bring notes with you if you have stuff that you don't want to forget.
That's a good idea.
And then we look in the ears. So I brought my otoscope today, so you might see one of these in your doctor's office. And so what we typically do is we're going to look into that ear canal, just
what are you looking for? I always wonder.
So when we look in there, we're actually seeing up into the eardrum. And so we're making sure there's no abnormal growths, or is it impacted with wax? Do we need to remove wax? So we can tell a lot just by looking in the ear. Sometimes we can see the eardrum bulging, and that means there might be fluid, and we need to send them to the ENT. So that's kind of what we're looking for, anything medical or anything occluding that could be stopping up and making them not hear good. So of course we look in the ears, and then we put them in a soundproof booth, and so that's where we do the testing. I just brought some of the inserts you might see that we put in a patient's ear when we're testing.
There's a picture of the booth.
Yep, exactly. And so we'll do testing where you respond to the lowest level you can hear at different frequencies, so that's a beep, and then we also have you repeat words. And so there's a lot that goes into the hearing test where we can counsel you on afterwards about what we think is the next step. So it's really good to sit down afterwards and talk about all of that, because as an audiologist, I want to make sure patients know all their options.
And really, it's a good way to get some peace of mind.
It is for sure, especially if you put it off for a while.
Exactly. So what's a good way to get in touch with you if someone needs to make an appointment?
Give me a call at 304-948-5565. I'm on the corner of 6th Avenue and 9th Street here in Huntington.
Yeah, and I've had my ears checked a couple of times. It doesn't take very long, and it is not painful.
Exactly.
Dr. Bashir, it's always great to see you.
Thank you.
Thanks.